Well, my name is Terry Jerkins. I've been in private practice here in Nashville for 28 years. I can't remember a time when I didn't want to be a doctor. I told my parents that when I was in kindergarten and never wavered. When I went to Memphis to train, I thought I would be an obstetrician, and then I got hooked on medicine. And in the clinic in Memphis, I had a lot of patients who were diabetic, and I realized how underserved they were, and that's when I became really impassioned by treating people with diabetes. And so that is how I ended up specializing in it. And then 22 years ago, I developed type 2 diabetes. And so all of a sudden, I had to put my money where my mouth was. And it was really a neat experience because it allowed me to really understand what the patients have to go through. And it gave me a lot more credibility with them. So that enhanced my tendency to treat diabetes even more. When Invokana came to the market, it allowed me to add to the list of drugs that I would personally take having type 2 diabetes. I tend to prescribe things only that I feel like make enough difference that I would think it was worth it for me to take it. The first word or phrase I think of when I think of Invokana is consistency, because it has the ability to lower A1C around 1%, not related to how long the patient has had the disease, not related to what other drugs they may have failed, and even in the patients who now require insulin. And so that's a consistency that most drugs don't carry. I like to use drugs that will affect more than one risk factor, and Invokana is admirable in that it will lower their sugar and their hemoglobin A1C, but it also affects blood pressure. The top three safety issues with Invokana would be the volume depletion effect, because you're peeing off sugar and it's pulling off fluid. And so I manage that by cutting diuretics in half when I begin the drug, and I ask my patients to monitor their blood pressure. So if they should have it drop, particularly if they're losing weight, we can decrease the blood pressure medicine. The other two side effects are related to an increased risk for urinary tract infections and for female genital mycotic infections or yeast infections. Those tend to be an issue with diabetic women anyway when their blood sugars are out of control. And as their A1C is lowered, they become less of an issue. That has been my experience with Invokana. In my patients on Invokana, they immediately are happy because their A1C comes down and stays down. They are able to work on weight reduction and not have a drug cause weight gain. And they are able to reduce other medications because of its effect on blood pressure and weight. So this particular patient came back in, and now her A1C is good, and she's actually sleeping all night because she is losing the glucose in her urine before she goes to bed. So she decides to get up in the morning and begin exercising before she goes to work, and she began to make better food choices. And even after 20 years of diabetes, because we had added Invokana and eliminated some of the other drugs, this patient was able to get her A1C in good control and begin to do things to help to keep it there. It's been gratifying to see patients be able to get their A1C down without gaining weight and to not have to put so many people on multiple insulin injections when they are going to have difficulty managing that. This particular patient had been on a factory line, and if she had to go on basal and bolus insulin, it would have put her at risk at work if she were not able to eat exactly on time or have time to check her blood sugar, and she didn't have that. I'm in with Invokana because this drug is going to give you a combination of A1C reduction, the ability to lose weight, and blood pressure reduction.
What is Invokana? Canagliflozin. Invokana is a prescription medicine used along with diet and exercise to lower blood sugar in adults with type 2 diabetes. Invokana is not for people with type 1 diabetes or with diabetic ketoacidosis, increased ketones in blood or urine. It is not known if Invokana is safe and effective in children under 18 years of age. Important safety information. Invokana can cause important side effects, including dehydration, the loss of body water and salt, which may cause you to feel dizzy, faint, lightheaded, or weak, especially when you stand up, orthostatic hypotension. You may be at higher risk of dehydration if you have low blood pressure. Take medicines to lower your blood pressure, including diuretics, water pills, are on a low-sodium, salt diet, have kidney problems, or are 65 years of age or older. Vaginal yeast infection. Women who take Invokana may get vaginal yeast infections. Symptoms include vaginal odor, white or yellowish vaginal discharge. Discharge may be lumpy or look like cottage cheese, or vaginal itching. Yeast infection of the penis, balanitis or balanopostitis. Men who take Invokana may get a yeast infection of the skin around the penis. Symptoms include redness, itching, or swelling of the penis, rash of the penis, foul-smelling discharge from the penis, or pain in the skin around penis. Talk to your doctor about what to do if you get symptoms of a yeast infection of the vagina or penis. Do not take Invokana if you are allergic to canagliflozin or any of the ingredients in Invokana. Symptoms of allergic reaction may include rash, raised red patches on your skin, hives, or swelling of the face, lips, tongue, and throat that may cause difficulty in breathing or swallowing, have severe kidney problems, or are on dialysis. Before you take Invokana, tell your doctor if you have kidney problems, liver problems, pancreas problems, are on a low-sodium salt diet, are going to have surgery, are eating less due to illness, surgery, or a very low-calorie diet, ever had an allergic reaction to Invokana, drink alcohol very often, or drink a lot of alcohol in short term, or have other medical conditions. Tell your doctor if you are or plan to become pregnant, are breastfeeding, or plan to breastfeed. It is not known if Invokana will harm your unborn baby. It is also not known if Invokana passes into your breast milk. Tell your doctor about all the medicines you take, including prescription and non-prescription medicines, vitamins, and herbal supplements. Especially tell your doctor if you take diuretics, water pills, rifampin, used to treat or prevent tuberculosis, phenytoin, or phenobarbital, used to control seizures, ritonavir, Norvir, Kaletra, used to treat HIV infection, or digoxin, Lanoxin, used to treat heart problems. Possible side effects of Invokana. Invokana may cause serious side effects, including ketoacidosis. Increased ketones in your blood or urine can happen with Invokana, even if your blood sugar is less than 250 milligrams per deciliter. Stop taking Invokana and call your doctor right away if you get any of the following symptoms: nausea, vomiting, stomach area pain, tiredness, or trouble breathing. Kidney problems, a high amount of potassium in your blood, hyperkalemia, or low blood sugar, hypoglycemia. If you take Invokana with another medicine that can cause low blood sugar, such as a sulfonylurea or insulin, your risk of getting low blood sugar is higher. The dose of your sulfonylurea medicine or insulin may need to be lowered while you take Invokana. Serious urinary tract infections may lead to hospitalization and have happened in people taking Invokana. Tell your doctor if you have signs or symptoms of a urinary tract infection, such as burning feeling while urinating, need to urinate often or right away, pain in the lower part of your stomach, pelvis, or blood in the urine. Some people may also have high fever, back pain, nausea, or vomiting. Signs and symptoms of low blood sugar may include headache, drowsiness, weakness, dizziness, confusion, irritability, hunger, fast heartbeat, sweating, shaking, or feeling jittery. Serious allergic reaction. If you have any symptoms of a serious allergic reaction, stop taking Invokana and call your doctor right away or go to the nearest hospital emergency room. Broken bones, fractures. Bone fractures have been seen in patients taking Invokana. Talk to your doctor about factors that may increase your risk of bone fracture. The most common side effects of Invokana include vaginal yeast infections and yeast infections of the penis, urinary tract infection, or changes in urination, including urgent need to urinate more often, in larger amounts, or at night. Tell your doctor if you have any side effect that bothers you or that does not go away. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. You may also report side effects to Janssen Scientific Affairs, LLC, at 1-800-526-7736. Please see full product information and medication guide on Invokana.com. Trademarks are those of their respective owners.